Good afternoon, everybody, and welcome to 1MD Live on our Sunday afternoon show. We have Dr. Shashank Joshi joining us, as well as Dr. Harish Shetty will be joining us soon. Dr. Joshi, I'm going to straight off start with an overview on the Omicron situation, as the cases seem to be declining, at least in Maharashtra state as well as in Delhi. And across the nation, there are some places where the peak is almost reaching. So can we sort of
Hello.
conclude that this wave is going down, or not? Over to you, Dr. Joshi. Go ahead, Dr. Joshi. We can hear you.
So thank you, Aniruddha. At the onset, we pay our homage to the father of the nation, Bapuji. Uh, we just heard our honorable Prime Minister as we talking in Mann Ki Baat of the various unsung heroes of India. Guru Anna just joined us. As we talk today on the 30th of January 2022, globally we see that the pandemic is at its peak. The largest numbers have been recorded, and predominantly the pandemic is seen in United States, Canada, which is North America, Europe, and UK. Of course, it's very much there in Africa still. South Africa still reports a test positivity rate of 10%. Then, of course, it's raging in India. There are pockets in Asia where it's raging. There are pockets in South America where it is raging. So, universally, if you see, COVID is very much around. Globally, we are seeing a mixture of predominant Omicron, which is more contagious, fast spreading, fast recovering. Most people with Omicron are mild. It's flu-like syndrome. But this analogy mild has been very deceptive because it is less severe. We know Omicron causes predominantly upper airway disease. And wherever it causes upper airway disease, most people are able to survive it. But where is the pandemic raging in India and abroad? It is in the predominantly unvaccinated population. That's where the severe disease is happening or the deaths are happening, either partial or total. People who are above the age of 50 and 60 or senior citizens. People who have underlying immunocompromised states, which means they have moderate to severe immunodeficient states or in compromised immunity, or their body cannot mount an antibody response. So a lot of people may be vaccinated, but they don't have ability to mount that antibody. And people who have underlying severe diseases, which in the old term was called as comorbidities, like uncontrolled hypertension, uncontrolled diabetes, chronic kidney disease, chronic heart disease, and so on and so forth. So that's where the pandemic is. Coming down to narrowing down to focus of India, two major changes and deviations occurred in the first week of January. We dropped testing asymptomatics because 90% of the population and the numbers were in asymptomatic population. So asymptomatic testing was dropped. And the contact tracing, which is asymptomatic, also was dropped. So a syndrome-based symptomatic approach has been adopted. So if you're symptomatic, you need to test, isolate, retest if you're negative, and take care and be connected digitally through telehealth with your doctor. So that's the first dictum. Secondly, you test people who are near and dear to you, around you, particularly if they are in the vulnerable groups. And what is that vulnerable group? People who are completely unvaccinated or partially vaccinated, people who are above 50 years, people who have at least a few comorbidities like hypertension, diabetes, heart disease, chronic kidney disease, chronic liver disease, chronic lung disease, and people who have immunocompromised states. Also remember, it is winter time. So in the winter time, we are seeing this pandemic where there is exacerbation of people who have underlying lung disease. So most of our ICUs are full with people with either heart disease or lung disease, which is the underlying condition. So the numbers we need to track, Aniruddha, are people who have been admitted due to COVID, small, very small number. People who have been admitted with COVID, which means they got admitted because of an accident or a stroke or a heart attack, and they were tested for COVID accidentally or cancer or dialysis. So hospitalizations due to COVID, hospitalizations with COVID, people in the hospital who are having COVID needing oxygen, people who are in the hospital who have COVID, who need oxygen and also need a ventilator, and the deaths. And those are the metrics which we have to follow. So obviously, this is far less severe disease. It is a definitely manageable disease. Our economic engines and educational engines have to continue. We are all awaiting our budget next week, and we know that we are growing at 9%. We are Atmanirbhar Bharat in its 75th year of independence. We are a resilient, strong India, but we need to be responsible. We still need to mask. So I want to dispel the myths related to the masking. Masking is very much an integral part of current dictum of COVID, predominantly because we live in closed spaces and crowded spaces. That's the first thing. Second is focus on air ventilation. Open the windows, have exhaust fans, have HEPA filters, have dehumidifiers, and have a humidity between 40 to 60%. Try to keep your air clean and circulated. Ensure that you get your vaccine shots done. Try to maintain a distance. When you unmask, keep a distance. And definitely, hand hygiene is back. Omicron has still some fomite transmission, which was probably not there in the Delta times. And don't miss that occasional Delta, which is still prevalent. So this is where we stand. The last point which I want to talk is more of a myth buster. 2 days back, it came out that there was a preprint which was coming out in the Chinese paper on Neocov. Somebody just asked that question, Deepa. Deepa, I have tweeted on this that this Neocov is not something to get worried about. This Neocov is not something that you should really get panicky about, because this is not something which we need to fear of. Okay, because this Neocov is not something to be fearful of, because if you fear Neocov, it will lead to problems. So this was actually an old 2012 bat virus, and this bat virus was being circulated for a long time, and it had a similarity with the MERS virus, which came in Saudi Arabia, and it had a receptor like DPP4. So this virus can have a receptor which is similar, called ACE2 receptor, and currently this virus receptor has not got any mutation in human beings. So this is all speculation, wide speculation. COVID has something called as wide speculation, and we should not fall for it. So something which we need to recognize very carefully and closely is we need to recognize that we cannot fall to wild speculation. We should not fall to wild speculation. So I had tweeted this, and I would like, if I can show the tweet to everybody here, that Neocold is an old virus closely related to the MERS Saudi Arabian Middle East respiratory virus, which enters the cells via DPP4 receptors. Neocon can use ACE receptors in bats, but they can't use human ACE2 receptors unless a new mutation occurs. So just that new mutation caused the so-called hype, Anirudh and Guru Anna, and that led to a sheer panic, and that sheer panic led to a situation which has gone to a scenario where people have literally got into this, I would call it a panic zone, and this panic zone has really been very detrimental for health, and right. I don't know whether I can share this I don't know whether you can get my window
showing up. Yes.
No, I think I'll stop sharing here. Let me see whether I can share my screen in a window,
right,
which might be more useful. And
yeah, you can just go to the other window. Yeah, you can go to the Twitter.
See this?
Yeah.
So Neocode demystified. Everything else is a hype, and this is not going to happen in human beings. So as simple as that. There's no need to panic. There's no need to get worried about. And it's important that we are in the modern age, modern era. So we need to behave responsibly. Mumbai and Delhi definitely are showing better numbers.
Hmm.
Their test positivity rates are hovering around 5%. A lot of population is self-testing and not reporting, and a lot of population is self-isolating and not testing and not reporting and
Hmm.
self-treating. I would advise and make a humble appeal through our show that self-test and report and be connected with a doctor. If you don't want to self-test, be connected with a doctor, but don't self-treat.
Right.
And do not take COVID for granted.
Absolutely.
But don't get overwhelmed by
Hmm.
fear and panic. So
Yeah.
I think you have to walk that golden mean. As we
Absolutely.
as we talk today, we have with us Guru Anna. You know, the 21 months of Vanvas of COVID has been very, very challenging for us mentally. So we have to look at kindness, gratitude, but happiness. How does one, you know, get happiness in COVID times? Because it has given us some form of a stress, some form of an anxiety, some form of a uncertainty. So, Guru, now how does one feel happy? How can I get a little more, you know,
A,
happier in this COVID times?
a lot has been talked about gratitude and kindness and happiness, but they all remain in the sphere of just a phrase and a word,
Hmm.
unless the context is not correct.
Right.
Managing the context has to be first, which means you can't put a rose flower on an arid land. You can't grow a rose flower in arid land. Sunflower grows anywhere and everywhere. Kamal ka फूल तो कहीं भी खिलता है, but you can't grow anything anywhere. And so, what is important is managing the context. And what is the context? The context is that there are residual fears of the first and the second wave. There is fatigue, minor, moderate, and major in different people across the world. Minor, moderate, and major. There is mild sense of uncertainty. When you look in Bombay itself, you see a number of people waiting for the buses and the buses being filled. And they're saying, कुछ होता है होने दो, हम लोग दाल रोटी के लिए हमें काम कर. There's a lot of helplessness in major cities, which does not see the headlines in newspapers or in TV channels or in shows like us. So let us look at residual fears, fatigue, mild, moderate, and severe. And the third is helplessness. So, unless this is managed, kindness, gratitude, and other things make no sense. So, as Dr. Shashank said, if you have to break the residual fears, open the stories of your past, write it down in your hand so that the emotions associated with the stories leave the page and the stories get quarantined. Tell yourself the facts of today, as Dr. Shashank mentioned, and facts can dissolve fears. And I've seen a lot of young boys and girls becoming very obese inside the house. And I yet see a lot of men and women who have been isolated, even today, not going out as much, sadly, very depressed. So, the second most important thing, apart from writing in detail about the stories that trouble you, not avoiding it. If you avoid it, it grows and it will actually explode inside your mind and body. The second most important thing, as I say, changing the context is that managing the fears. Facts can dissolve fears. When you appropriate facts in your psyche, it slowly gets into your in your unconscious, and fears also slowly they actually dissolve. That this is the state at where we are. Mask remains the best vaccine. The third is helplessness. There's a lot of helplessness, and there's a lot of learned helplessness, as I've said that before. Helplessness is ऐसा ही है, अपने को ऐसा ही जीना नहीं, अपने को ऐसा ही मरना है. This is the thought. I mean, when I say die, it's not die in literal terms. Live our life in this manner. And it's easy to say to that man who's on the bus stop waiting for the bus for the last 1 hour. Easy to say, but for him it's so difficult. So helplessness, fear, residual fear, and fatigue can be managed by only telling ourselves, let's do, let us do, let us do small things inside the house and small things outside the house, which
Absolutely.
which means that which means that the best thing to do is to I was saying little joys. I'm now saying micro joys. If you're having your meals and your tea, have it mindfully, even if it is with kindness. When you're having a meal, see that you talk to everybody, or let everybody speak to each other. See
Hmm.
that your diet is managed, and come what may, in whichever state you are, 10 minutes of 10 minutes of spot jogging,
Hmm.
or 5 Surya Namaskars, Utak Baitak, or 20 minutes of a walk can really turn that around. At the same time, see that prayers and any form of meditation might help you to clear the context so that you can actually express kindness, express gratitude. A lot of people told me that when they spoke to old friends, they felt much better. A lot of people tell me that when they do things which they liked long ago, they felt better. And these are non-expensive, inexpensive things, not very fancy things. No, there's no need to go to Maldives all the time. So these are small things, and there's the many families who told me that when they just walk with their family on a road or in a ground which is plain, hand in hand, and they felt much better. And what happens there? Connectivity across the family, connectedness across the entire community helps. Lastly, if you may have all observed that some of you may have attended yoga shibirs with 1,000 people, or a talk by a guru with 1,000 people. At that point of time, it's not the words of the guru that work, but being part of the big mass of people, being part of that big whole makes you feel connected. So these are the small things by which you should change your context of helplessness, residual fears, and fatigue. And if at all you're depressed, it's essential that you see a professional. Lastly, I saw a patient yesterday who had not had bath. He used to have bath for 6 days. That man really did not know what to do. He would have a bath for 6 days, not cook, not really do anything much, because he or she need not work. But the point is, when you do not do your routine, simple, normal activities, the chance of you having depression much higher. So the answer is, I don't feel like having a bath. I said, even if you half feel like having a bath, enter the bathroom. Half feel like having a bath. There's no need to be completely happy to do things which we like and which we actually need. So these are the small things we need to do. Thank you for the question. But I would like to ask you, Dr. Shashank, a lot of patients have come and say that their RT-PCR and their rat test is negative. Early days of feverishness. But I insist that they repeat it, and 9 out of 10 times it comes positive. And those who feel that it is negative early, they go around the world, and they tell people that I've done my test, I'm negative, but I had some amount of feverishness. What is the right approach to test in Omicron space of the COVID disaster?
So now you know that RT-PCR can be negative in 30% of people who are having the virus harboring with them, and rapid antigen can be negative in 50% to 60% of people who are harboring the virus. So we have to give them a timetable of 3 to 5 days. If you are symptomatic, isolate. If your test is negative, continue isolation for at least 3 more days and repeat the test after 3 days. Because many a times we have seen this, particularly in Omicron times, that you are often negative the initial times, including the rapid test, and subsequently you come positive. So I think it's important that you protect yourselves and protect others. And if you have to move around, then ensure that you double mask appropriately and move around. See, ultimately, COVID is going to be a disease where every person we are going to encounter with us is potentially infected until proven otherwise or in a biobubble. So you have to take COVID appropriate behavior. This is what we started doing in the HIV days. We called something as a universal biosafety guidelines. So now for COVID, you need universal biosafety. Presume everybody is positive and has harbored the virus, and you ensure that you mask and protect yourself from the same. And ensure that your air ventilation appropriate, your humidity is 40 to 60, and you have an air filter on board, you have exhaust fan or HEPA filter on board, and continue your life. So that's the right way, Guru Anna. But I completely agree with you that if you're symptomatic, strongly symptomatic, be connected with your doctor. The doctor is able to clinically distinguish from a regular flu or a winter flu or a cold from a, a Omicron or a Delta. It's important also to recognize, Guru Anna, that currently also there is a little scatter and a sprinter and a sprinkle of Delta around, particularly in South India and Western India. In North India, it may not be as prevalent, but predominant strain is still Omicron, and we are getting better. Mumbai, Delhi is definitely receding. Maharashtra is at its peak around very peak areas. Rest of India will peak soon. So I think it's important to recognize that we need to ensure that if they don't, and Deepa is asking a very important question: what do we tell people who don't want to get tested and avoid isolation? I think they need to ensure that they wear appropriately fitting double mask and don't infect others, and don't eat out in company of other people, because that's reasonable if one does it, because that's something which we need to recognize globally also.
Yeah.
I do not subscribe to the myth that we should go
Hmm.
for a zero masking. I completely disagree with that. There is no science behind that.
Yeah.
We still
Jason
need
has
to.
asked a question, important question. Could you
Yes.
put it across here?
Sir, I'm having CKD and COPD. I'm taking tofacitinib for rheumatoid arthritis. I have a history of pneumonia. What kind of mask should I wear? And I need to travel for work? What kind of precautions I need to take?
So, Jason, you are into a high risk category.
Hmm.
You are into a vulnerable category. You are taking immunomodulator drugs.
Hmm.
You have chronic kidney disease. You have chronic lung disease, and therefore you need to protect yourself much more than others.
Hmm.
Because if you get COVID, your likelihood of deterioration is high.
Right.
So appropriately fitting double mask is very relevant for you.
Hmm.
It can compromise your COPD, and but it's important that you have a N95 mask, which is appropriately fitting, and do not eat unless until it's an open air environment and you are not near other people. That is the best, which is reasonable. And if you get symptoms, you should test yourself. So that's
Okay.
all you need to do.
Okay.
And ensure that you get vaccinated. And if you are above 60 and if you're eligible, get your extra dose or precautionary dose on board.
Hmm. Dr. Joshi, I'm going to go through quite a few of the questions that are pending. If you don't mind, we can do a little bit of a rapid fire. Uh,
Sure.
Dr. Prashanta Kumar Chaki says many of the physicians routinely are doing biomarker tests in all COVID affected patients. Is this required in all patients?
So in asymptomatic, no, unless you are into a vulnerable category. And
Okay.
the three tests we filter out on that is CBC,
Hmm.
CRP, and D dimer.
Right.
And they can be done every third to fifth day. And they
Okay.
have to be done under medical supervision. But
Okay.
sometimes what happens is, in absence of symptoms, if doctors do
Hmm.
not, they want to see if there's something underlying happening,
Right.
biomarker tests are done. So I
Okay.
usually leave it to the discretion of the doctor. But a
Hmm.
third to fifth day CBC, CRP, D dimer is reasonable.
Okay.
If you can't afford it, just simple CBC, CRP is also good enough.
Hmm.
It tells you the extent of progression, that's all.
Right.
And it is a clinical discretion which you need to understand. In
Hmm.
asymptomatic people, I don't think you need anything.
You don't need
But
it.
in symptomatic people, you definitely, if you are deteriorating, if your fever
Hmm.
is persistent. So remember, COVID is classified as asymptomatic and symptomatic.
Hmm.
Monitor temperature and saturation, and ensure that if you are symptomatic and if you are having temperature, you need to do a lot of tests. If you are desaturating, we have persistent cough and symptoms, you need to do a lot of tests. And therefore, it's very crucial and critical
Hmm.
that we do that what is correct. So it's
Right.
important that sometimes you may need to do the test, but continuously doing them every second day, third day is not appropriate.
Not required.
It
Okay,
generates
doc.
more panic. So there is no role for X-ray, CT,
CT and all of that. Okay.
testing, or self-treatment.
Hmm.
There is no need for unnecessary antimicrobial therapy also. There is no
Okay.
need for unnecessary antiviral therapy also. Let me put it on record that
Hmm.
all you need is symptomatic treatment, reassurance, good sleep, good diet, ensure that you are cheerful and happy, and just handle your isolation in a more focused way and a more fruitful and a happy way.
Okay. Uh, Nandakumar Oratkar is saying, after precautionary dose, my missus had fever on the next day, lasted for 2 days, and cough is still there. I had fever on fifth day, lasted for 1 day, responded well to Dolo, very well. When will the cough go?
So cough can be nasty. Cough
Hmm.
may take a little longer time. Cough will need a connectivity with your doctor. If it is
Okay.
a dry cough or a productive cough, if there is
Hmm.
secondary infection, might need antimicrobial therapy. Often persistent cough, which is dry and hacking, might need an inhaler of a steroid under medical supervision. Some
Hmm.
cough might need attention. So cough definitely needs a connectivity with your doctor. And cough
Okay.
sometimes can be tardy and can be seen up to 2 weeks also after Omicron.
Okay. Dr. Parag Wagode is saying, if children between 15 to 18 are exposed to COVID, when can they take the vaccine?
1 to 3 months, ideally after 3 months as per Government of India.
Okay. And Dr. Prashant Moge is saying, please give guidelines about exercise post Omicron infection. Is it same as of Delta or is it different?
So Delta was more focused on the lung and pranayam and biofeedback.
Hmm.
Omicron is more focused on nose and throat.
Hmm.
So maintaining appropriate nasal and throat hygiene is as important, but ensuring that you do appropriate breathing exercise is equally important. Simple
Okay.
brisk walk for with 10,000 steps is good enough. If you do yoga, pranayam, meditation, chant Gayatri mantra, it is equally good. So it's
Okay.
important to recognize that you need to declutter,
Hmm.
detox, and ensure that you get into some physical activity mode. But don't overstretch yourself, because a lot of patients with Omicron have
Hmm.
persistent fever, and then that is followed by fatigue and myalgia, and it
Right.
takes a little longer time to recover. So in them, if you do a proper biofeedback like yoga,
Hmm. Hmm.
yoga has multiple components. It has
Hmm.
kriyas, which are cleaning processes. It has asanas, which are postural exercises. It has
Correct.
pranayama, which is breathing exercises. And it has dhyana, which is meditation. And if you do each of these components, and preferably under a direction or a supervision of a yoga expert, it will
Hmm.
definitely aid and hasten your recovery with
Hmm.
appropriate diet, which is predominantly sattvic, with predominantly having adequate sleep. It will definitely see that you are out of this, little worse like flu-like syndrome, quick and fast.
Dr. Deepa Amar says, few of my patients are still positive after a week, but no fever or cough. Can they go to office? I tell no. What is your advice for them, sir?
So Deepaji, you are right. They could still be transmitting or harboring the virus.
Hmm.
If they have to see, Government of India does not allow the statement which you are making. It has to be
Hmm. Hmm.
individualized. If you're
Right.
asymptomatic for more than 3 days, and if they are daily wage earners, and that is a source of their livelihood,
Hmm.
then Government of India said that they should go back to their work with a double masking.
Okay.
But if they are not daily wage earners and they can afford to wait at home, then
Hmm.
we
Hmm.
say that at least wait for 10 days, because virus is replicative in the first 10 days. And after
Correct.
10 days, they can resume work independent of the RT-PCR test. RT-PCR has one drawback, which is it tests
Hmm.
dead virus and live virus. So we don't know
Right.
whether the person is shedding the dead virus or the live virus. The
Correct.
antigen test is a little more superior there. A negative
Right.
antigen test means you're unlikely to be contagious. So
Okay.
this is would be what we do and we tell our patients.
And one last question from Rajiv Gupta ji. A friend has asked, has had mild fever from 14 to 17 Jan with dry cough. After 17, no fever or dry cough, no medicine taken. Oxygen level always more than 96. Do I need to take a blood thinner? History of hypertension and diabetes.
Cardiometabolic conditions like hypertension and diabetes merit a blood thinner.
Hmm.
Like simple aspirin is good enough. A low
Okay.
dose aspirin is good enough for a person like this. And
Hmm.
definitely you need to, for persistent cough, probably take an inhaled steroid if required under
Hmm.
medical supervision.
Okay. And Dr. Usha Chenuru, last question. What is impression of Omicron on thromboembolic phenomenon? Is it like Delta?
So Ushaji, it might be more than delta also. We don't know.
Okay.
So me and Dr. Pandit are collecting this data to find out if there is a thromboembolic phenomenon in the cardiometabolic cohort,
Hmm.
which is likely to deteriorate who are obese in the
Hmm.
Indian situations. We have occasionally seen D dimers going up, occasionally some heart attacks and strokes. These are
Hmm.
anecdotal reports, but we are clearly vigilant that microthrombi can be seen, and there might be a role for a simple low dose aspirin or ensuring that they are properly given an antiplatelet and a cardiometabolic care and a statin therapy on board may
Hmm.
be relevant even in the Omicron era, because we do not want to see any sudden deaths. These are simple things where we need to be alert and focused. And remember one thing, that in the filter which we have, our
Hmm.
population in general has a large population of heart disease, blood pressure,
Right.
or hypertension and diabetes. And therefore, when they have these underlying comorbidities, as we call them, it is
Hmm.
important that we give them preventive medicines which help them not to throw up clots or thrombi, or
Correct.
have MRI. So therefore, sometimes agents like antiplatelet drugs like a low dose of aspirin, or sometimes clopidogrel, or sometimes
Hmm.
even novel anticoagulants like levodoxabran and others
Hmm.
may be used. So these are scenarios which we see, but we have
Hmm.
to be cautious and careful. This is not for everybody, but
Right.
in those dedicated cohorts where there is a cardiometabolic underlying disease, sometimes
Hmm.
these could be life saving as well.
Okay. One question for Dr. Shetty. Dr. Shetty, especially after this Omicron wave, we have been hearing post COVID, a lot of patients are having massive issues with sleep, and no, with no history of any previous sleep disorder. However, this challenge is going on almost for a month or so, or even beyond, and then that sleep disruption is very difficult to get back to normal for most of the people. And in that, added social media is not really, addiction is not really helping. So what would be your practical tips, Dr. Shetty, for post COVID sleep issues?
There are many scenarios here, and the first scenario is that because of COVID, other tests get done. I still remember a young man coming with vitamin D less than 3 and vitamin B12 less than 80, which was undetected across time and which came up right now. So seeing that your nutrients are within normal limits is extremely important for sleep also.
Right. Right.
And this gentleman had mood symptoms which got aggravated because of COVID. And so this is number one. Number two is, what does COVID tell you in your mind? What do you really write on your software, that what did you have, what effect it had, and what is the interpretation of COVID in your mind? So the second part is, if you write in your software, I had a flu-like illness, it came and
Right.
gone, I live life normally, is also
Hmm.
a important aspect for coming back to normal, sleep included.
Right.
Sleep is a part of coming back to normal. The
Correct.
third most important thing is people who have a lot of fears with any COVID infection, nose, chest, lung, no nose, no chest, no lung, no symptom, but still positive. They have a phenomenon where they believe that their immunity is low. They believe that they are not like the rest. When others also boast in front of them, तुमको हुआ, हमको नहीं हुआ, हम भी वहीं गए थे, हम भी वही 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 खाना खाया, तुमने भी नहीं मास्क पहना, हमने भी नहीं मास्क, आपको हुआ. And then they tell themselves they have
Hmm.
low immunity esteem.
Confidence. Yeah.
Immunity esteem. No, no, it's a different
Right. Immunity esteem. Yeah.
immunity
Yeah.
esteem. And low immunity esteem would mean my immunity is less, so I feel low about it. And then when you chew that thought repeatedly, even if you recover from the virus, you do not recover from what you interpret about the virus, and then you have a lot of problems. Isolation, as you know, can go and cause a Netflix addiction. I have not
Hmm.
some of my favorite lists which have been
Yeah.
given to me. I need to finish that completely now, and that also aggravates the sleep. And the last is those who have lost people in the last waves, and they have a COVID-3. They
Hmm.
still are able to get over that. There are many people who come and tell me that they actually stay awake all night and they sleep at 5 o'clock and they're up at 10 o'clock. So
Yeah.
I would say If you are not having COVID on a normal day, if you have a phone in the hand, it's perfectly all right. But in COVID, see that the phone ceases to live after 8
Yeah.
o'clock. You kill the phone at 8 o'clock so that you awaken the phone in the day if required. So that is very important. Also, those who are having Omicron or any other disease also also suffer from brain fog, which is very common. And the brain fog, we do not know what it means. So fuzzy feeling associated with depressive symptoms. And if there are real depressive symptoms and insomnia, the most important thing is to see to it that you don't deal with insomnia for too long a time. I want to fight insomnia. If the insomnia is intractable, you don't sleep at all. You sleep only for 1 or 2 hours at night. You sleep for 2 days in a week, and 5 days you don't sleep. Don't wait. Get yourself sleep by treatment from your family doctor, and then continue doing all the things which I have said. But also see to it that you do a lot of yoga, a lot of pranayam, exercise, and if there are any stories which are really affecting your life and not about COVID, see that you attempt to resolve. If it does not resolve, put it in the fridge or in the cupboard so that sometimes some stories just dissolve after some time. So you need to do basic physical hygiene and activities of emotional hygiene. If you've lost your job and you have no money, and that really causes you a lot of uncertainty. EMIs, you'll have to sell the house and go to a smaller house on rent. You have booked a seat for your son in some college, and you have no cash to pay. I have enough patients coming and saying that my daughter has got university confirmations from more than 7 to 10 places, but I don't have the money to really send him or her, and that causes a lot of guilt and insomnia. And if that is so, then really let go and reflect with a mental health professional so that he or she is able to help you to deal with that situation, accept that situation as it is, because opportunities will not go away, and there are enough opportunities even in India, maybe as not as good as that in some places in the world, but accepting that this is the state and I need to fight it, and again come back and live it after some time is something which people do. So there every person with insomnia after Omicron or COVID two is not because of the same cause, it's because of different causes. So you need to address the various aspects, the various issues around insomnia, rather than assuming that it's only because of COVID. But yoga, exercise, sharing your feelings, having a routine is a must for everybody.
Absolutely. What a wonderful thought. Just one last question to you, Dr. Shetty, regarding the increased child obesity and the impact of
Yeah,
it
yeah.
on mental health. And the same thing I would like to ask Dr. Joshi regarding childhood obesity during this pandemic period when they are at home. So I'll start with Dr. Shetty and then Dr. Joshi.
12 to 18, I know of a young boy who has put on 20 kgs of weight, 17 years, and he was jogging, he was doing everything, but in the last 2 months he's he's caged in his house, and that caused a weight gain. And obesity is a sure trigger for anxiety, depression, and for fatigue, and for inactivity, and for so many other things. So then the easiest answer they give when I tell them is, I'll start from next Monday. I'll start on the 1st of February, or my birthday is coming, and this is my birthday resolution. I tell them they have a false myth. They need to jog as much as they've jogged earlier, or do exercise as much as they've. I said, no, don't do that. Just go down your house and just walk around the building once. I tell them only once. Huh? Oh, that is so easy. I'll do it just now. And they go and say once, and they give a call and say, "Maine aaj ek kiya." Then I keep quiet and I say, "Don't stop today. Do it." And then on the seventh day, they say, "We felt like doing 5 rounds," and I did 5 rounds. And then as you know, I don't know, Anirudh would know, but Shashank would know. Old timers like us know of the crankshaft in the truck. You put the crankshaft,
Yes.
turn and it
Yeah.
turns. So that's what you need to do very, very metaphorically with children. And also when children are in groups, they do much better. Tu bhi aa, hum bhi aate hain. Chal. तू भी आएगा, हम भी आएगा. अभी साला बीच तुम लोगों ने, शशांक, तुम लोगों ने उसको बंद कर दिया, तो बहुत बहुत तकलीफ है. उसको जरा स्टार्ट करो. तो अभी so groups also do, and sometimes girlfriend and boyfriend. One father was against the boy's girlfriend or boy's need for that same girl, but he allowed him to go with the girl because he found at least obesity ke liye this girl is helping my son. So that is really good enough. And there are a lot of endocrinological issues and other issues, and which Dr. Shashank would want to explain in detail.
So thank you, Guru Anna. Your Ganga Chitnis is saying that your bright color of your T-shirt is very glowing and fluorescent and therapeutic. So that's something very useful. None of us have closed the beaches. The administration does. We are mere advisory members in a task force telling them how to handle the pandemic better in terms of medical management. The crankshaft analogy was excellent. Rebooting yourself is very important. Children have tended to become slow and sluggish and sust and must, getting addicted to their devices and eating too much fast foods. So fast foods kill fast. All these Swiggies and Zomatos are leading to obesity and diabetes, and are actually detrimental to health, if you ask me. Having home cooked food made by children themselves may not be a bad skill set to teach them to counter this obesity problem, because it's very, very it's a problem of the future. Putting that extra fat at this age is going to
Absolutely.
lead to heart disease and diabetes and cholesterol and what have you, like fatty liver, or in a woman, a polycystic ovarian syndrome. So it's very important to recognize that don't order foods. Teach the child the skill set of doing a small little housework.
Yeah.
Make them globalized. We are local now, so they can wash utensils, they can clean up clothes, they can hang clothes.
Absolutely.
They can learn the regular life skills they need, rather
Correct.
than addicted to their mobile phone or their television screens. I think it's
Absolutely.
important to recognize that they need to get into engageful activity which will make them self-sufficient. And that's so crucial and critical to overcome childhood obesity, because if and they will do it with love and pleasure. Yeah, and they can be incentivized too, and the incentive should never be food.
Absolutely.
In India, the incentive all over the world is celebration is through sweets, but celebration
Yeah.
should actually be much more than that, and the reward should be much more than that. Food should never be a reward. So it's important to recognize that we are mindful of
Yeah.
what we are doing, and mindful eating is very important, which means that you should taste and share,
Yeah.
not taste and be selfish and gulp, not
Yeah.
taste and crave, taste and share. So that's very, very important to recognize that this is a very, very contemporary issue of toning the craving and the food behavior and the exercise behavior and the activity behavior of a modern child. Modern child is inquisitive. Modern child wants to move. Modern
Yeah.
child wants to learn. Modern child wants to be engaged. And if you are able to get the rapt attention and getting them gainfully engaged without being, forceful with them,
Correct.
that's very crucial. One Indian DNA we have is we have a special gene called laziness gene, and we have it, and our children imbibe it. It's important to recognize that a little bit of discipline, a little bit of danda, a little bit of variation in that, if it is made fun,
Yeah.
full. So fun full without making fun, making it positive without being negative, making
Right.
it proactive, where they voluntarily participate rather
Correct.
than being forced.
Forcefully.
I think it can go a long way to handle obesity, because obesity can bankrupt economies through bad health and
Yeah.
non-communicable diseases, which will kill our population in the 30s and 40s through heart attacks, through diabetes, through hypertension, through all that. And
Yeah.
remember, in the COVID times, the excess deaths are going to be observed in the non-COVID world.
Yes.
It's going to be observed in the non-communicable disease space,
Disease.
which is
Yeah.
going to be heart disease, which is going to be diabetes, and
Yeah.
uncertainty is only making it worse.
Absolutely.
So I'm certain that in times to come, things will open up. For
Yeah.
things to open up, responsible behavior is equally important. Citizen
Yeah.
participation is equally important. Being cheerful and not irritable, being proactive and positive and not negative and panic mongering, is also
Yeah.
important. So it's important that we go with that mindset now.
Yeah.
I think we need to go with a mindset not of rebellion and revenge,
Yeah.
but with a mindset of responsibility, with happiness, with cheer
Absolutely.
around us. And I think that's exactly what Guru Anna has been trying to teach us for the last 2 years. And that's the path we have learned to swim. We want swimming pools to open, we want beaches to open, we want the world to be open, and we don't want to be contained. But we need for that responsible behavior.
Yeah.
We need to participate actively in ensuring that till we don't vaccinate every person on planet Earth, no one is safe.
Hmm.
Till we don't mask in crowded spaces or close clustered environments, you're not safe. Remember,
Correct.
even if you've got a Delta in the past and an Omicron now, and I've got two vaccines and a precautionary dose, you can still get another Omicron. We have
Right.
BA1, we have BA2, we have BA3. If you have got BA1, you might get BA2. So it's very much going to be around. You need to be still cautious, you need to be careful, you need to be proactive and pragmatic, but you cannot be living with the fear, aa jayega, ho jayega. We need to rightly strike the right balance. So I think it's all about the virus in the mind, how we handle it, how we behave about ourselves, how honest we are to our own self. I think that's the key. I think it's that we cannot cheat our own self.
Yeah.
And therefore, if we want to walk through this COVID times, we need to ensure that we are honest to behave appropriately in COVID times.
Absolutely.
Not recklessly, not irresponsibly,
Hmm.
but rightfully, responsibly, with a little bit of care, compassion, and a lot of cheer. We just can't be all the time fearful or panicky. So I think it's the right balance, and I think it's all in the mind, and which is why mind gurus like Guru Anna have taught us to swim through this pandemic. We need to swim with happiness. Its health is not just about getting some numbers or a negative PCR or a negative antigen.
Yeah.
Health is about, if you don't get a negative test, at least you should not have a negative attitude, and you should not feel chained that my test is still positive. Your attitude still should be positive, that I don't want to infect others, so I just need to wear a mask, and I
Yeah.
still can do very pretty much everything I need to do, and I just need to handle a couple of more days and reboot my life. So just think that you have to recharge.
Yeah.
I, I often have a people who tell me, ki, it is 8th day now, my test came positive. I don't have any symptoms for the last 8 days. And what do? I said, look at, this is your recharging time.
Hmm.
This is your rebooting time. It's just like mobile battery, very tired. COVID just was accidental finding.
Yeah.
We got you contained at home.
Yeah.
Reboot your mind, reboot your body, put down your priorities, re-put your order, and go back to life with fresh zest, zeal, enthusiasm. Okay,
Absolutely.
just that negative test cannot curtail you.
Yeah.
You still are very much free in your mind. Your
Yeah.
thought flows are not disrupted by COVID.
Yeah.
Brain fog which occurred in Delta is much less with COVID of
Hmm.
Omicron. And if it's occurring, you can see a doctor. You might need a micronutrient correction with B12 or D3. You might need some other micronutrients to be on board. You might need to
Hmm.
take some magnesium to sleep well. You might need to take some melatonin to sleep well. Be connected with your doctor. Engage a conversation with your doctor. And if you feel doctor doesn't have the time to talk to you, engage with a counselor, or we have Guru Anna who can give you the mind cushion and the mind coaching you need. So and allow you to direct you to a person who can hear you
Hmm.
out. Because also
Absolutely.
what has happened is that people have got a lot of what I say is emotional, the burden of emotional index is very high. It's all bottled up. So, and then COVID comes, and in that isolation, that bottled up emotions lead to fast heart rate. So
Hmm.
I've observed this with a lot of people with COVID. Their saturations are normal, their fever is
Yeah.
not, their temperatures are normal, but their heart is beating and pounding and beating and pounding and beating
Yes.
and pounding and the rest. So the fast heart rate and the restlessness which we are seeing in COVID cases is all linked
Hmm.
probably to that extra burden of
Hmm.
emotions which have got trapped, which need a release, appropriate release. And if you don't have it, don't feel shy to go to a counselor or a mental health expert or a mental health
Hmm.
doctor, because they can direct you in the
Right.
right and ensure that you're happy. So that's what I would like to say. It's
Yeah.
all common sense, and living with the right attitude and the right spirit is
Yeah.
what really matters. Like spirits, generated so much of controversy. Spirits
Hmm.
can mean ghosts. Spirits can mean the wines which are going to be going in the shops now. So our spirits could just be spirituality, a connect with Almighty. All these are occult things. All these are things of controversy. When there are controversy, there is rapt attention. So it's important to recognize that you need to digress and divert on
Yeah.
things which will make you happy, but they should not be reckless or irresponsible, which will make you vulnerable and make mistakes. So I think it's
Hmm.
important to draw that Lakshman Rekha. It is important to draw that line, which is very important. But at the end
Hmm.
of the day, it's all about good health and happiness, and it's all about a frame of mind which makes you more confident, which makes you more responsible, and it's all about your own self. So I think it's
Yeah.
important that you spend time on yourself. I think COVID and Omicron has allowed a lot of people with a less severe disease to get into an introspection mode. But if you have gone into a negative spiral, it's time that you bounce back.
Hmm.
Don't bounce too much. Don't bounce with recklessness. Don't do extreme things. Do things in moderation, and that's really the art. And
Yeah.
uh, and that's something which is very very important to recognize.
Yeah, absolutely. Wonderfully explained, Dr. Joshi. I'll just take two very small questions if you can just answer those. Dr. Avinash Kinikar says, isn't it worth doing IgA level in Omicron lung involvement?
I would not do Avinash anything. I would just treat the lung involvement as regular COVID.
Okay.
I will give them steroids. I'll give them oxygen. I'll monitor them. I'll get them in the hospital, and that's how I will treat them.
Okay. And Dr. Deepak Mashu said, do patients who have had COVID first and second wave have taken 2 doses of Covishield? Should they still be taking a precaution booster dose?
Absolutely, after 9 months, they should be taking the next dose, precautionary dose if needed.
All right. Your last thoughts, Dr. Joshi, and then Dr. Shetty, you can close.
So I think I summarized everything what I wanted to
Yes,
say.
yes.
Stay safe,
Absolutely.
stay happy, be happy, and I think Anna always has the last word because he's
Yes.
been our mentor through these pandemic times. And maybe we have learned a little charana from him, and we have tried to not just learn it from him. As I always say, what you listen, you learn, but what you learn, you should adapt. If you can't, you just learn and listen, but don't adapt. It's really not worth it. Rather than
Yeah.
that, I think the small little thing and change which you make, you should not just listen but learn and adapt something which is a good habit. Habits are difficult to change, but
Hmm.
I feel if you have a little more resilience, a little more of effort, we can make that little difference. So Anna, the floor is all yours. You can wind up.
I
It's
would
a bright day
like,
today. Just Man Ki Baat is just over from our honorable Prime Minister, but we'll have Guru Anna's Man Ki Baat now.
I am really grateful for all those who have joined from different cities of the country, Patna, Delhi, in South India, Dharwad, and of course, Captain Rajiv Gupte from Pune.
Yeah.
Captain Gupte, thank you for sharing all these insights with all your friends in the WhatsApp group among Punekars and others, and also among friends in the merchant navy. So I would like each one of you have joined to share some of these nuggets in your WhatsApp groups, and that is so important. I will close the show by what Jason says, and that I think is so beautiful. A beautiful
Yeah.
line. I mask for you, you mask for me, and that would really save the entire mankind. With that, thank you.
Absolutely.
Good day. See you again next Sunday. Take care.
Thank you so much, Dr. Shetty and Dr. Joshi. Have a great Sunday, everybody.